Hi, everybody. Very warm welcome to you. Thank you for joining our Community Connect session, the TB Vaccine Advocacy Roadmap, mobilizing a global advocacy response. I'm Mike Frick. I work for the TB Project at Treatment Action Group in New York. I'm very happy to be here moderating today's session with colleague Ria Lobo, who will introduce herself shortly. I just wanted to say a couple words about today's session and to really start with the title, this TB Vaccine Advocacy Roadmap, and what we mean by that, because that's what our speakers have contributed to and what they'll be talking about. The TB Vaccine Advocacy Roadmap, what we call TB Vax ARM by short, is a coalition of civil society, advocates, scientists, people who've survived TB, and other TB affected community members who've come together to, on an ongoing basis, do consistent and continuous advocacy for new TB vaccines. And we are chaired by IAVI, Treatment Action Group, Results UK, the Global TB Caucus, Stop TB Partnership Working Group on New TB Vaccines, with TB survivor and advocate representation. This is sort of our core group, but the coalition itself is much larger than that. And we wanted to talk about the coalition and some of the work that we're doing today. The general goals that we've outlined for ourselves are to, in line with our global targets to end TB by 2030, ensure a fully financed pipeline for TB vaccine research so that we can have new TB vaccines available, licensed, and ready for rollout by 2025 under a really ambitious scenario, 2028, perhaps a more achievable scenario, but in time for 2030. So we're going to talk about how to make those goals a reality today, and I'll hand things over to Ria to introduce herself and our speakers and start the discussion. Thanks for joining us.
Thank you so much, Mike. My name is Ria Lobo. I am board member alt of communities at the Stop TB Partnership. I'm super happy to be here. I think that vaccines is one of the most neglected portions of the TB response. It's something we've not spoken about enough. And with COVID-19, we've realized how important it is to invest in vaccines if we were to tackle pandemics. And so TB by itself is largely neglected. Vaccines really fits at the bottom of that priority list. So I think it's really important that we change that to understand what this actually translates to. In 2020, we had just 117 million US dollars invested in vaccines when the actual requirement is about 1.4 billion. So we're not even meeting like 10% of that requirement. And so this is a really, really important initiative, and I'm happy to be part of it with this amazing group of people who we're going to get to meet right now. To begin with, I'm very happy to be joined by Deborah Ikea, who is does this really important role of getting parliamentary support in West Africa and Francophone Africa. She's currently the Global TB Caucus's manager of that region, and she's based out of Nigeria. And I'm super happy that she's joining us today. So Deborah, I'm going to start with you. I'm just curious in terms of, we had this UN high-level meeting commitments in 2018, and people committed, but they didn't deliver. And I think it's important to understand, why is it so important to garner a domestic response for R&D, within countries? And just want to hear your thoughts and your opening comments on this topic. Over to you, Deborah.
Thank you. Yeah. Thanks, Ria. Thanks, everyone. I think that the importance of organizing a domestic response, whether for TB Vax R&D or for implementation, cannot be overemphasized. And like you said, commitments have been made, but how do we make sure that those commitments translate into action? You made mention of COVID-19. Let me just remind us that, the BCG vaccine is over 100 years old, and we are still here struggling, with a vaccine for TB. Meanwhile, COVID came before our very own eyes, and before we knew it, bam, there are multiple vaccines for COVID today. The question really is this because TB vaccine is not relevant, or is it because we lack the sufficient push by everyone that matters. And in this context, I mean a strong push that is driven by TB affected communities, CSOs, governments, policymakers, donors, researchers, and grassroots advocates at the country level. That domestic response is very, very important. And in simplest terms, I mean a unified front that is brewed from country level efforts for one single cause, a quality vaccine that is available, acceptable, and accessible for all. And I think without doubt, the TB Vax arm presents us with a very, very perfect platform to drive this as a global response. However, I think it is very, very crucial that there is an organized multi-sectoral approach in this regard at the country level in order to establish, that link, that connect for easy flow of information and feedback into the global body to achieve a very, very holistic response that's probably, and that would properly articulate the voices of people affected by TB and the technical inputs of all relevant stakeholders. So, in terms of domestic response, I feel like the establishment of these close-knit relationships at the country level will help, guarantee that we leave no one behind and that TB R&D and implementation is led for communities by communities. And we feel like this will translate into better commitment and ownership and even uptake. And let me just finalize by drawing our attention to the fact that the dynamic response that other diseases have used in the past over the years is the reason why they have accounted for the successes that they've recorded. For example, COVID, I'll mention again, we saw the strong advocacy at all levels, matched with very high level political commitment. And this is what made the pandemic everyone's business. This is what led to the joint task forces that were pushed for at the grassroots level, at the community level. Resources were mobilized from public sector, private sector, repurposing of funds and all of that. The TB community needs to learn from this. And I'll stop now by saying that every single person, if we understand the assignments and play our roles fully, we will not be having this conversation. I'm grateful to be here. Thanks, Ria.
Yeah, I think you're muted. There you
Sorry.
go.
No, I love what you said about I think they need to be pushed, because Olia mentioned this at the opening ceremony, her speech at the opening ceremony. Olia is a TB survivor from Ukraine, and she said, for the world to do something, we need to push the world, and I think it's really, really important. So moving on, I'm gonna call upon my most favorite person in America. Sorry, Mike. Sorry, David. But Kate O'Brien is a TB survivor, a TB advocate with We Are TB in America. She is by far the most flamboyant, friendly, amazing person in the world. If you do not know her, I'm sorry, you're not living your life properly. And I'm super happy that she's part of this panel. Kate, just a couple of things. One is, I know you got TB when you were pregnant. And I could imagine how uncertain that felt. You don't know what's going on. You don't know if your baby's going to get TB, if the meds are going to reach the baby. It's all that confusion. And I think and pregnant women are one of the most neglected groups, and one of the, parts of the vulnerable populations that we don't really think about. And just between you and I, actually, when I had my first baby, I was so scared that because I had such a cruel time with TB, the doctor actually said that let's just test your placenta and check if you have TB in your placenta. Maybe it's still there in your body. Because we didn't really have a test to see if you do not have TB anymore. When it's extra pulmonary TB. So I'm super keen on listening to you about what you think is the role of communities in advocating for a new vaccine, and also how and why it's important to look at these vulnerable groups.
Okay, good. You can hear me. I got to be really dynamic now, so that was a really good lead in. So I'll give you the razzle dazzle. But these two things I think really tie in together, right? Because I think that with community is one of the things that we can really offer in terms of advocacy is putting a human story and human cost to a bunch of data and figures, right? That we're always using. And, it's really easy for people to tune out when they're not really realizing that could happen to them, that they're not realizing that could be their families and that could be their situation. And so when that's like the biggest role that I think communities can really play in advocacy in general is just really reminding people and reminding the advocacy community as well, to be talking about people in the right way and to be engaging people in the right way and to be just adding the humanity to it. I think, when we're working a lot with like epidemiologists and data driven people and scientists, like that's really important. And when we talk about people that are kind of typically left out of clinical trials and left out of research, it's kind of remembering that humanity, that these are not data points, they're people, and people come from complicated health histories sometimes, or even not that complicated. To me, pregnancy isn't that complicated. A lot of people do it, and when I had tuberculosis when I was pregnant, everybody was acting like this was some crazy outlier. But I knew a ton of people my age that were pregnant, and it really, like, again, just like like the way it was treated was just like, this is so weird. You're pregnant and you have TB, and it was like, but there's people doing that all over the world. Um, there's people all over the world with diabetes and TB, and there's people all over the world with HIV and TB, and people don't exist in the real world, without a health history. That's just not how it works. And so, again, I really think as advocates, when we talk about our full story, our full lives, reminding, people that people have full, detailed lives and health histories. And, we also have children who are always left out of things completely. And, that people have different stages in their lives. And again, like, so that thing of not being a data point, but being a true three-dimensional person, I think kind of answers both of your questions. I hope.
Kate, that was razzle dazzle enough for us. That was amazing. Thank you, Kate. I mean, getting to your point about engaging communities, right? I think communities are not engaged enough from the science community at all. And which brings me to my next panelist, Chalika Pandey, who is an immunologist and a public engagement researcher from Switzerland. And she, I know she's a huge advocate of engaging communities in the process, from trial design to dissemination of information about vaccines. And so, Chalika, I'm just curious to hear what you think about why it's important to empower communities with understanding the science and the research process, and sort of making them demand a vaccine, and not so much of I think high burden countries don't pay attention to vaccines enough, especially it's not a priority there. They're just busy trying to figure out just coping with the disease itself, right? Like active disease. So what are your thoughts on this?
Okay, thank you, and thank you for inviting me to the panel. I really liked Kate's point saying that as scientists, we always see the data point. As an immunologist, you have the data and you have the data point, but we need to remember that we're actually researching using human samples, and they have lived experiences. They have how they interact with TB and how they interact with other health burdens. So I think that's why there's a motivation and a growing need, especially from younger early career researchers, to actually interact with the communities, not only taking the samples, but also emphasizing and advocating to them why we're doing the research and why we think it's important for them to be involved in the process. So not only taking part in the clinical trials, but also understanding how they work, and also contributing maybe to ethics review boards. And I think what's very important, especially from a scientific point of view, is there are certain assumptions that are made about people's understanding. And I think COVID has really taught us that everyone has access to information. It's the type of the information they have, and also the way in which we relay information. And maybe one of the reasons why TB vaccines are not a huge priority for people in high burden countries is that they don't understand how much more it can contribute to reducing the overall burden when it exists. We don't have it now, but we need to think about in future when we do have the resource. You need to be there at the door knocking and say, give it to me similar what we saw with COVID. And I think we are slowly getting there. There's a huge push, and platforms like this where researchers or advocates, and you don't necessarily have to have experienced TB. And I think that's one thing that we need to focus on. You don't have to experience TB, but if you're from a high burden country, you might have known somebody, you might have cared for somebody. And even that experience is important to be part of this topic. So I think a more holistic representation of advocates and also who you advocate to, not only focusing on funders, but also focusing on the recipients of the medical devices when they will be ready, so that they're ready for demand. It's like there's also a need of demand creation. And I think that's what was missing generally in health spaces. We focus on the solutions, but we need to remember that people need to receive it and need to be ready for that. So yes, that's my point. And yes, thank you again.
Thank you, Chalika. In fact, even just a personal story. But when I got TB, first got TB, I told the doctor that he was wrong, and he asked me why. Why do you say that you're wrong? And I said because I've been vaccinated. So how can I get TB? So even that piece of information that that vaccine is not effective for me as an adult is just not disseminated. People don't know, and it's confusing me a little bit. Like why do I still have that mark on the BCG mark on my hand? So I think that's really really important points. Moving on, we have with us David Lewinson, who is a pioneer in his own right. David, don't give me the humble face, but he's really an amazing researcher and advocate himself. He's the chair of the working group on new TB vaccines and a professor at Oregon Health and Science University in America. And we're so happy to be joined by David. David, I know that I've seen you in action, and I've seen how you've recently been advocating so much with researchers to engage with community people, and I think that it's really a two-way street in some ways, right? Like if you want, if the community needs to demand for a vaccine in order for researchers to be able to work on one, and so just wanted to hear your thoughts on our researchers really answering the questions communities have, and also, why is it important as a researcher to advocate for your work, and why is that an important use of your time? Why should researchers be advocates to begin
Well, Ria, thank you. Although I'm a little sad that I'm not even your second favorite person.
with?
But I'd like to kick off with a sort of a personal story, and get back to try to answer some of the questions you had. So, I was a medical resident in San Francisco right at the peak of the AIDS epidemic. And we were just beginning to appreciate the ways in which TB and HIV interacted in ways that we really didn't appreciate. But at that same time, I think we saw act up in some incredibly powerful advocacy movements that really brought together the power of both advocacy and understanding research in ways that proved to be incredibly powerful. And so I got really interested. I was an immunologist by training, but got really interested in TB because it was clear that understanding how the human immune system worked would really be powerful, both in terms of developing vaccines and diagnostics. And from the standpoint of a researcher, this is an incredibly exciting time. We've seen just amazing advances in human immunology that have led to really incredible advances in diagnostics. And I think most importantly, we've really seen the power of TB vaccination, which I think is really highlighted by the 72 trial. Now, my perspective on that is that those antigens and that vaccine was discovered in the late 1990s. And so I have to look at results coming out in 2018 as being a little bit. And through my work with the partnership, what I was really impressed with is I would go to the partnership meetings and we'd hear a real demand and interest in new drugs like limited, and I would never hear anything about vaccines. And I really began to sort of ask myself first, why are we not creating that? Why are we not creating interest when the science really supports the feasibility of vaccines, both in terms of that they could work, but also in terms of TB eradication? Like, where is that? And how could I, as a researcher, be better engaged and sort of really help create that demand? And then conversely, sort of how can I learn from advocates to be a better advocate? And it was completely new to me. And I don't think I've learned enough quite yet, but I have to say that the sort of TB arm to come. That is incredibly exciting to sort of see this coalition of people come together really to demand those vaccines that we know will really help eradicate this disease. So that's my sort of personal story. And thank you, Rhea.
Thanks, David. I think you raised some really, really important points. And the other bit is also that by investing in vaccines and TB, other diseases could benefit as well. Like we saw with COVID, right? Like we're sort of using TB machinery for everything that we did, right? And so there really is great value in investing in new vaccines for TB. I just want to make a quick point to everyone who's joining us. If you have any questions, sorry, please, if you have answers as well, just please add your comments in the question and answer section, and we're happy to discuss any questions that you have or any doubts that you have. We're all here. We're all here to do that. So please, Mike, over to you.
Thanks. Yeah, hopefully we'll get some answers to our questions. That would be really nice. So I want to try to connect two ideas. Let's see if I can do it in a single question that I'm going to address to two people on the panel, Deborah and Chileka. Deborah, you talked about the importance of building demand, political will, and mobilizing a domestic response, and particularly from countries that have a large burden of TB. I think this is really important. And it strikes me that we have a pipeline, a TB vaccine pipeline that's actually pretty advanced. Depending on how you count, there are 5 or 6 vaccines ready for late stage efficacy studies. These will be conducted in high TB burden countries. Some that have participated in TB vaccine science for a long time, others that may be just sort of entering the game now that we're at this phase of the pipeline. And so my question is really, how do we do things? How do we take advantage of this opportunity to be late stage, conducting so many trials, to raise the attention for TB vaccines on a domestic political agenda, get governments to sort of buy into those studies? That's my question for you. And my question for Chileka is, how do we take advantage of this opportunity, these studies, where we're going to be collecting, hundreds of thousands of participant samples, these data points that immunologists like you can actually learn a lot from, to do immunology work that's in country? How do we make sure that the samples stay in country so that scientists in high TB burden countries, early career researchers, can benefit from this kind of incredible opportunity that we haven't had in decades to do TB science? So I hope that's clear. Maybe we'll start, Deborah, with sort of the political demand piece, and then Chileka with sort of the country national level science and capacity in that sense. All right, Deborah.
First things first, I like to say that we need to establish that link. Before we are able to mobilize resources, like I mentioned earlier, there needs to be a strong relationship at the country level between relevant stakeholders. But then we talk about advocacy. But I just want us to remember that true advocacy is when people speak and they are heard, and that there is no, doubt that advocates, researchers, we have, the unrefined first-hand information. But you would agree with me that it is not enough, to gather information. But the real question is, how do we transfer that information for action, for change, and for accountability? Community advocates engaged in grassroots efforts can easily, engage in international advocacy and effectively pass their message through this platform that we have, which is the TB Vax arm. But then another opportunity for international advocacy, for our message to get into the ears of those who need to hear them, to get on the tables of those who need to act on them, is engagement with parliamentary networks. For example, the Global TB Caucus, which is a unique network of over 2,500 parliamentarians with support of civil society in over 150 countries of the world. If we are talking about TB vaccines and domestic resource mobilization for TB vaccines, if we have members of civil society, TB affected communities, engaging with the Global TB Caucus as focal points or as members of the Global TB Caucus platform of experts, I think it will present a unique way, it represents a unique opportunity for grassroots advocates to directly interact and discuss with parliamentarians, because parliamentarians vote for budgets, but parliamentarians, they make the laws, they put in place these policies at the country level that can help us to mobilize, the funding, the resources that we need to drive, this response. Like I mentioned earlier, we need to make sure that CSOs are able to partner with members of parliament, like we've seen in several efforts that have been driven by the caucus. Partnership between CSOs, affected communities, and parliamentarians to submit position papers that can be debated, that can be endorsed, in parliaments, and also even within regional parliamentary networks that will translate into impact for funding for vaccines R&D. And also, just to say that in the near future, it would really be great to see individual governments committing the appropriate percentage towards TB vaccines, towards the R&D that we're talking about. But we will not be able to achieve that if we do not have a TB community that has one voice, one single voice at all times. Time will not permit me, but if you allow me later, I can come back to talk about some initiatives that can help us to mobilize more funding for vaccines.
Yeah,
Thank you, Mike.
let's circle back to that at the end when we'll think about actions and where to go. But Shaleka, if we can turn to you now for maybe what we can term like the country-led immunology science, TB science. Like, how do we take advantage of the pipeline to support that piece of things?
Okay. Thank you for your question. I think a lot of that also lies around policy and policy in research. We also need to recognize, as countries with very high burdens of TB, we do have the power in that there are no other places in which TB vaccine research can be done at the scale of a phase 3 study. And we need to come together and say, if we're going to do this research, if we're going to take part in this research, then this is the minimum number of samples we need to retain. We can't be retaining 10, 15% of samples that are left. We need to be retaining the majority of it. And if the counter argument is that you might not have the resources for that, is that you can apply for funding and also increase the research capacity of local researchers to do high-level immunology research. So, for example, I'm an immunologist by training. I trained at the University of Cape Town in South Africa, which is a very privileged institution. I specifically chose to do my training within South Africa because of my proximity to the people who are actually affected with TB. And also it gave me the opportunity not only to conduct health research, but also when I do immunology research, I remember and I'm in the presence of people who actually experience these diseases, and I think more holistically of the impact of the research that I want to do. So definitely I can say when we're signing those agreements, we need to leverage the bargaining power we have to retain as much as we can. And if funding is the issue, then help us write grants to fund the additional research we do. And also ensuring that holistically as a region, we also need to empower others who might not be as highly resourced as a country as South Africa. Other countries that are equally high burden that also take part in trials, but do more of the public health research, which is important, but they also need to build capacity in their scientific and immunology research capacities. Another thing that I want to add is that while doing these clinical trials, we also have the amazing opportunity to interact more with the community, not just taking the samples, but also explaining the processes involved in it, why this study might work, why it might not work. Even if it doesn't work, this is what we're going to learn from it. So also use those opportunities to increase the activities and the importance of community advisory boards. And also make sure that when you conduct these research studies, that the participants not just receive a note that, oh, this study has come out or have now published. Ensure that the research that's published is presented to them as well, and they understand what's happening and say, okay, maybe it's just a small slice of the cake, but you've contributed to this small slice, and this is how it's going to improve the general movement and propensity at which we can actually achieve a TB vaccine when we do achieve it.
That's great. And what I'm hearing from you too is it's sort of about these long-term alliances and accompaniment between civil society and government, between scientists, north, south, 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 and scientists and communities. And I think that's what we hope VaxArm will allow us to bring together. So Ria, over to you for the next question. And we have a couple that have come in the Q&A, some good ones.
Yeah, I'm actually curious, Mike, who wrote this? I mean, I want to know who wrote this question on what are the challenges and is there any way to motivate CEPI, Gavi to work as hard on supporting R&D efforts for TB vaccines? I want to direct this question to David because David, so just in terms of just you've been in this field for a long time and you've worked with various organizations and we found it hard to get organizations to support vaccines. We'd love for Unitaid, for example, to support vaccines, TB vaccines. And so just would like to hear your thoughts on what are the challenges of getting these organizations to support it. You're on mute, David.
Okay, is that better?
Yeah, it is, yeah.
Yeah, I mean, I want to start a little bit with what Shaleka mentioned as well, which is that enormous challenge with TB vaccines in the sense that we don't fully know what we're looking for. People would call that correlates of immunity in the sense of what kind of a response are we looking for that will help us predict whether a vaccine is going to work or not and sort of speed us to licensure. And I think it's really that there's going to be more than one thing, that different vaccines and different vaccines may all work differently. So there's really an imperative to figure that out. And there's no doubt in my mind that the science supports those efforts. It's sort of, there's no doubt. So there's almost a moral imperative there to both collect those samples in the context of vaccination. And I agree to do the work collaboratively, but in those settings where we can really understand how vaccines work. So there's no doubt that we have the science that would support that. And so what we're really lacking is the ambition to do that. And I think it was already highlighted that when you can put the desire and the resources and to some extent the public-private partnerships in place, there's no doubt we can make this happen. And so, we as the TB community kind of need to be way more in the sense the money we're talking about relative to many, many things, COVID is a great example, isn't really very much. It's really not. And so your question, to get your question is, then how do we entice sort of either existing organizations or those that don't even exist yet to really become really motivated to really support those vaccination correlates immunology efforts? I don't think there's a simple answer to that, in the sense that that's almost an initiative that we're going to have to see come from those countries that are both affected by TB and also the resources to support those efforts. I think we're going to have to look really hard and to sort of create the, and I think that comes, even though I'm in immunology, that's really about advocacy. That's about creating that demand and the moral imperative to say, this is really not okay. It is not okay to say we're going to develop a vaccine in the late 90s and get the first results from it in 2018. It's really not okay to not even have plans in place for phase 3 studies for for M72. We don't have that phase 3 study really in hand, and that's much less worked out for the other vaccines that Mike mentioned. So we should be absolutely doing multiple parallel evaluations of these vaccines and at the same time understanding how they work. And I think we as the community need to really demand solutions. I think if the money's there and we have the advocates, then there's absolutely no reason that those organizations that you mentioned couldn't be incredibly effective. But they don't have the resources to do that now. So we have to sort of create the demand and resources for them to accomplish that.
So David, just to to follow up on that, do you think that in order for TB vaccines to be a priority, it should be donor driven? So like a donor, like something like how malaria got a vaccine, because it was predominantly donor driven, right? Like someone came and said, okay, you need to support I think it was Gates, right? Who wanted a malaria vaccine. So is this something that we are lacking in TB? People don't have the will to support a fully funded pipeline?
Absolutely. I mean, you look at this and you're like, we can absolutely do this, right? There's no reason not to. I mean, my perspective on COVID has been really enlightening, because so much of that has been about public-private partnerships. So it's absolutely about donors and about credible organizations sort of coming together to fund those efforts and to make them happen. But it's also about market failure. And I think you sort of talked a little bit about malaria, but you know, and Mike, I think, knows way more about than I do. But GSK is a fantastic example of a company that really invested in developing the M72 vaccine, really laying the groundwork for the vaccine, and then ultimately handing that over to the GMRI, sort of both kind of lead the manufacturing and lead the clinical trials. And so to me, that's a market failure. That's sort of saying, if you're absolutely right that we need to fund the upstream stages, but we also need to make ensure success of those vaccines. And whether that means sort of a guaranteed market or incentives to purchase vaccines before we even know the work, those sort of partnerships, I think, are really key. And they're working in TB, and they've also been working in malaria, in the sense of sort of how do we really guarantee that once we have a vaccine, that's going to be widely distributed, purchased, and utilized. Sorry, that's, I'm sure, that you wanted, but I think these are all really overlapping key issues in trying to make it work.
Yeah, and David, I think you really hit the nail on the head. We When you say that, we really need lot of energy into the whole vaccine pipeline, not just at late stages but also early stages. Kate, I'm getting you in right now, my favorite person in America. How do we create the demand generation? Like what David was talking about, right? We need partners to come together. And I think I don't often hear community people stand up and say, "Hey, I need a vaccine." Other than the past, year and a half, we've been making a lot of noise. But how do we create this? How do we create TV champions to further this cause?
It's funny that you said that, because I was kind of thinking it as we were going through this session. Just even my own advocacy. I feel like I'm the first person to talk about regimens, and I'm the first person to talk about diagnostics. But even I think all of us as advocates, like whenever we talk about R&D, we always have to make sure that we mention this vaccine. I feel like we all want it. We're all talking about it. We all feel like it's the way to really truly get to elimination. But I just don't think we're in the practice as much of constantly mentioning vaccines when we're mentioning other R&D needs. And we should be, because to be honest, like we just saw it happen with COVID. We know it's possible. We have good candidates. We're closer than we've ever been. And so I just think, as all of us, like, when we've been doing it to any amount of time, we start to almost kind of get trained, you know what I mean? Like, and we tell our stories in the kind of context of our experiences, which were pre-vaccine. So, you know what I mean? So we're like, I want to improve this aspect of my care. I want to improve this aspect of what happened, without thinking that, like, it could never have happened, period. You know what I mean? Like, I could have never, have had active TB, because if I had had a vaccine available. So sometimes it's like, kind of like, I think with advocates, already it's kind of just changing the way you do advocacy. Like, never mention R&D without the vaccine. It's possible. Like, it's got to be a part of the conversation when we're talking about research and development needs, like, all the time. It can't be like, we need this, and this would be great. You know what I mean? Like, it's got to be a part of it from the start. And I think that's something that, I just think, honestly, just mention vaccines all the time from the beginning. And also, like, because we're kind of still at that kind of jump off point, we should be thinking about, like, our access to these vaccines from the beginning, and like ways to make sure that people will take them and use them and have them. So that's another thing that I really think advocates really are poised to do and can really do well, is to kind of think about that, like, kind of end user, you know what I mean? Which would be someone like us and our families, like, um, making sure that when we're having these conversations about producing the vaccine, that we're also already kind of thinking about how to get it to people that need it. Did
Yeah,
I
and
answer your question, or was I just going on a spiel?
no, you did, and
Okay.
also like just having that 100 days of developing a new TB vaccine, like we did with COVID, right? I think we need more marketing strategies like that, right? And
Yeah.
thank you for raising the point on access. I think that was great. Got a couple of questions in the chat, Mike. Can you take that over?
Yeah, there's a really perceptive question about, given how large the funding gap is for TB vaccines, where you quoted, the Stop TB partnership says we need 1.4 billion a year at least invested in this activity, and we know from the TAG and Stop TB data that we only have about 120 million spent each year. So that's a really enormous gap, and you could look at that and feel sort of like a fatalism set in, and like we'll never bridge it. So where do we start? The question is, how do we start to chip away at this gap? How do you prioritize a funding ask given that the gap is so large? Do you swing for the fences and say, we need large advanced market commitments of the type that BARDA issued to COVID-19 vaccine makers to de-risk? Do you go to governments and say, it's okay, start small. A couple $1 million is going to be a lot for this field where the denominator is just 120 million, and will grow from a small amount into something bigger over time? It's a really good strategy question, and I'm just curious to hear people's thoughts on this. Maybe Deborah, we'll start with you because you talk to governments a lot. What do you think government appetite is for like going in with a big ask versus start small, or do you see it a different way? And then anybody else who would like to contribute, because I think this is the key question, really. How do we frame our ask? Thanks. I think you're on mute on my side, at least. We'll give the tech time. Yeah.
All right.
Good. Still having issues. You're unmuted, but we can't hear. Maybe, should we
Could
go
you?
to somebody?
I
Can you
think
hear me?
Deborah, if you could mute yourself and unmute yourself again.
Okay.
Oh, no, you're fine. You
Oh,
can hear you now. You can hear you now.
yeah.
Do you hear me now?
Yes.
You hear me?
Yes.
Good. So I was saying that from everything that all of the speakers have said, I think for me, from in the context of my work, what is missing is the political will to drive this very, very, single ask, around the vaccines itself. And I also see that there is a bit of disconnect between the researchers, the people, doing the on ground, the research and everything and all of that. The evidence is there, for God's sake, but sometimes the evidence does not get into the ears of those who need to hear them, who need to, fund this approach and all of that. Kate already mentioned the fact that we need to be more proactive about all of this. And I think supporting initiatives that are targeted towards TB funding, both locally and internationally, is very, very key for us to mobilize these resources. Supporting efforts such as the Global Fund replenishment, the TB 33% that is targeted towards increasing, the percentage for TB under the Global Fund is very, very key. These are some of the ways that we can be able to mobilize the resources. The evidence is there, honestly, for us to see. TB continues to kill, and we can reverse this for the sake of, saving lives and everything. But very, very importantly, I think what we have in the at the global level, the TB Vax arm, is an excellent platform, but we need to replicate this at the country level so that there is this connection between all of the stakeholders to the governments of the individual countries, specific ask around vaccines. How do we make sure that on time we reach out to the parliamentarians. On time we bring up this topic to the tables that need to take action, like I said earlier, to say that this and this and this is the evidence. What do we do next? I think it is very, very important for us to do that, because when we have all of this in place, then we can present our findings. Then meaningful actions can be taken. And I like to say that it is high time, everyone. It is high time that we devise. I know we can't do all of that right here on this call, on this session, but it is high time for us to go back to the drawing board and think of the most effective way to hold those who blindly refuse to take action. Because it doesn't mean that people are not hearing what they need to hear, because our governments were in New York in 2018. They made this commitment. So it is high time for us to devise a means of holding those who blindly refuse to take action accountable, or those who selectively, choose to concentrate where they choose to concentrate efforts on. COVID is a good example. I'm not going to go into details, but I think it is high time for us to devise that means of holding people accountable when they know what the issues are, but refuse to take action. We saw what happened to the replenishment. It doesn't mean that our voices were not out there. We put out the voices. But the question is, did we effectively galvanize at the country level, and get our voices heard? I think it is very, very important. And I think I will just close by saying that right from the very bottom, let the evidence be clear. Beyond context, only then can we achieve our goal. Thank you.
Thank you, Deborah, and I couldn't agree more. I think, especially the part where you said TB Vaccine is excellent, and more so, I think we need more support at a domestic level, at every country level, right? So that we get our governments to be accountable for what they committed to. And it's interesting to see we have actually a bunch of really interesting questions in conscious of time. But quickly, just to run to David and Chalika, there's a question about how would an academic health professor wanting to start thinking how to advocate, or an advocate or community member wanting to link up with researchers, what is the first thing you suggest they do to get started? So, David, just let's start with you.
Yeah, yeah. And just a very quick point to get to Mike's question too, which is, to me, it's all the above. In other words, we have a desperate need for early stage vaccine candidates that might be developed across the world. And we have a desperate need for things like vaccine trial sites. So it might be that the asks are going to be different depending on the location. So in terms of how to become a better advocate, I would be very open to give me a note, give me an email. We can get you set up with the partnership or with TB Vax Arm. So I would love to hear more. Sometimes, if you're a TB scientist, sometimes the TB meetings like Keystones can be very helpful. But I would love to hear from you, and I think I can help point you in the right direction.
Chalika, do you have something to add?
Yeah, I think I echo what David said. Reach out. In terms of community members and being advocates, I think it's also mobilizing within your communities. Are there other like-minded people that feel strongly about it? Do you have opportunities like community town hall meetings with if it's functional, because it's very different in different countries, your councillors, the wards, members of parliament? Generally, in some cases, you have somebody who champions TB or champions health in general. And those are the people to advocate if you're looking for policymakers. If you're looking for people within your community, I think mobilize and find more like-minded people. If you're looking for people that you want to interact more in terms of the research field, I think now people are becoming very open, and people have realized the importance of this, given what I've experienced for the past 2 years. And they're willing to talk and actually have more conversations with non-scientists as well. So depending on the type of advocacy you do, there are different levels. You can do that. As a researcher, I think if you're in an academic institution, there's been a lot of push for community engagement. If you're fortunate to be an academic institution that does that, and that's the way in which you can advocate to people who actually need it. And together you can devise a way collectively to advocate to people who have policy and who have power to make policy and money potentially. It shouldn't be just as a researcher, as a community person, or as an advocate. I think collectively, and that's the beauty of VaxArm, is that collectively we have a better voice as opposed to one person talking about their own agenda. We can have a unified agenda and go to the specific avenue we need for the specific ask we want.
Thank you, Chalika. And every time we have a conversation about advocating, we can't finish this conversation without Kate saying something because she's been such a strong advocate. Kate, so just want to hear your thoughts as well.
I just want to be the person Raya thinks I am, but I'm going to try my best here. But I just wanted to say, like, in terms of the earlier question, I do advocacy with the TB Roundtable, and when we started asking for bigger numbers, in terms of funding, and this is, again, United States government funding, we did get bigger numbers when we asked for bigger numbers. So we didn't necessarily get exactly what we wanted, but we got more. So I just want to piggyback on Deborah saying, like, we don't have to be afraid of asking for what's actually right. We don't have to be afraid for asking what's actually needed. So for these vaccines, like, if that's the need, that's the need. And I feel like we should ask for what we actually need and not be like afraid of turning people off to it. We like, just like you said, we have like the data behind it. We have good candidates. Like, we really can do this. This isn't some pie in the sky thing anymore. Like, we have like what we can actually do it. You know what I mean? And it's not only the right thing to do, it truly is money well spent. So I just think the argument is definitely there. Like, don't be afraid of a big number for something that kills, millions of people, so I mean, I just don't know what else we should be spending money on. Like, so I just don't be afraid of that big number is like what I want to say. That's it. Go big, American, go big.
That's such an important point and a good one to end on. We need to ask for what we need, and everyone should know that the numbers we're asking for are not big numbers. They're big for us in comparison to what we've received so far, but these are not big numbers. I mean, you can pick any comparison you want to put it in perspective. The election that we just had here in New York State the other day on a single ballot measure raised $4.2 billion for green infrastructure, in just one state with one ballot measure, creating a market for, a green economy. So, we're asking for 1.4 billion a year for TB vaccine research globally. This is not a big number. We can create a market for this. We can drive demand for it. We can use new financial tools to do that, and ask donors to help us find a way toward that. So that's a perfect note to end on, Kate. We do need to wrap up. I just want to thank everybody for joining us, those in the audience and on the panel. Sean put into the chat a way to get involved with TB Vaxarm. I think, to sort of build on the answer to the question of how can a scientist or anybody start to do more advocacy, if you put your toe in this water and decide you want to go for a swim and come along with us, the TB Vaxarm meets once a month by phone, and we do lots of activities and coordination in between. Joining a call is easy. We won't expect you to have all the answers on your first couple calls, but you can see what this activity is about and go alongside us doing it. And we would love to have you there. So follow the information that Sean shared if that sounds of interest to you. And I just want to close by thanking the extraordinary panel and my co-moderator, Rhea, and Sean for helping organize the event, and the union for convening us. And thanks so much, everybody. And we'll celebrate the TB vaccine at a future union conference. But until then,
by 2025, that's what we want.
All right.
Thank you.
Bye.
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 Bye.